The number one killer worldwide remains to be cardiovascular diseases. In the Philippines, the picture remains the same. Actually, in 2011, the number one killer remains to be heart diseases, recorded to be 15% of all total deaths recorded for that year. Now, there are risk factors that are contributory to the development of your heart diseases and your heart attacks. There are three main groups of risk factors. One would be your behavioral risk factors that would include your smoking, your harmful use of alcohol, your unhealthy dietary habits, and of course, the lack of exercise. Another group of risk factors would be your metabolic risk factors. These risk factors would include your medical conditions such as systemic arterial hypertension, your diabetes mellitus, your high cholesterol levels, and of course, obesity and overweight. The last group of risk factors would be your non-modifiable risk factors. These are the things that we cannot really do anything about. For example, advancing age, your gender, and of course, your genetic predisposition. The older you are, the more prone you can develop heart diseases. Now, between males and females, at the same age, males would be more prone to develop heart diseases. More so if women are still menstruating, they are protected from heart diseases. However, if women are in their menopausal years, they are now equivalent to the risk factors of a male in developing cardiovascular diseases, your heart attacks in particular. The basic problem that happens in acute heart attacks is that there is a sudden decrease or cessation of blood flow to your heart muscle. And this sudden cessation in blood flow will be brought about by the buildup of bad cholesterol. This buildup of bad cholesterol may be chipped off, which will result in the formation of your clot that will totally obstruct or partially obstruct your arteries that will now result in your heart attacks. Another reason why people suffer from heart attacks is that there is an imbalance in your nitric oxide levels in the body. Your nitric oxide is a very important substance in your coronary arteries that will serve to dilate your coronary arteries. Without this, your arteries may vasoconstrict and will cause a decrease in your blood supply that will now eventually result in myocardial infarction or your heart attacks. Primary prevention is preventing the onset of disease. On the other hand, secondary prevention is preventing the occurrence of the same disease. Oftentimes, we catch patients in the late stages. We catch patients who are already suffering from heart attacks or from strokes and the like. It's because it's the lack of primary prevention. Now remember that cardiovascular diseases, your heart attacks, are significantly preventable. If we can do things at the onset, then we could prevent the disasters brought about by heart attacks. There are 3 steps. One is you have to eat healthy. You have to eat high fiber diet like fruits and vegetables. You have to eat less of fat and less of meat. Number 2 is you have to exercise regularly. What we advise is you have to maintain a regular form of exercise, say just brisk walking for 20 minutes a day, 3 to 4 times a week. And of course, if you already have the disease and if you want to prevent the disease, there are lots of medications and supplements that you can resort to.